Good morning, and thank you for joining us today for our free webinar, Tips and Tricks for Telemedicine Insurance Billing in Washington, featuring Sarit Hirschkorn. My name is Jeff Bloom, Education Marketing Manager here at LASA OMS. With the current state of the acupuncture profession, the nation, and the world, we have decided to add to our webinar offerings to bring in experts in telemedicine, practice management, and insurance billing, in addition to our traditional clinical skills-based webinars. Our guest speaker today has graciously agreed to offer sessions each day for specific states so we can focus the content and share the most relevant for you. I will just go through a few housekeeping items now. We do recommend viewing the webinar in Chrome, Firefox, or Safari, as you may experience slowness in other browsers. If you're having issues with sound, then try either clicking the screen to allow sound or try refreshing your page. Same, if you experience any freezing or delays, try refreshing the page, and if that does not work, we would suggest trying to watch in another browser. Also to mention that everyone who registered for this event will receive a link 5 minutes after we conclude to watch the webinar on demand. Lastly, we will be holding questions till the end. If you have a question for our guest speaker, please use the questions tab to assure that we ask it. To communicate with other attendees or to communicate technical difficulties, please use the chat tab. Now for our featured speaker, we are pleased to introduce Sarit Hirschkorn. Sarit is co-founder and co-owner of AllAcuServices LLC, a company specializing in insurance billing services for acupuncturists, massage therapists, naturopathic doctors, chiropractors, physical therapists, and social workers. After spending nearly 2 decades working in corporate benefits outsourcing for multi-million-dollar companies such as PricewaterhouseCoopers, ACS, and Mellon Bank, Sarit now applies her deep knowledge and understanding of the insurance industry to the field of insurance billing for holistic care providers. Please join me in welcoming Sarit.
Thank you, Jeffrey. Good morning, everyone. Thank you for joining our webinar today. And what I want to do is I want to focus on telehealth and telemedicine. I'm Sarit Hirschkorn. I am the co-founder of AllAcuServices, along with my partner, Robert Venna, who is a licensed acupuncturist in the state of New York and in the state of New Jersey. I want to go over today what is telehealth, just the terminology, and then I want to talk about telemedicine. How does it fall under telehealth? I want to talk about what are the things that you can bill for as an acupuncturist. How often can you bill for telemedicine? And then we'll talk about how do we actually submit a claim? Like, what are the codes that we should be using for telemedicine? We'll talk about a formula that will guide you as to what to charge for telemedicine. So based on your current prices, how to figure out what you should be charging. And then we'll talk a little bit about the HIPAA guidelines and consents and these kind of things. So we're going to go on to the next slide, and we'll start with some terminology. So telehealth is the use of electronic information and communication when it's used by provider to provide services such as delivering of the diagnosis and discussion of diagnosis with a patient, consultation, maybe a treatment, education patient, care management that you are going to give to your patient, and then self-management of the patient. So that is telehealth in general. Telemedicine is an avenue that falls under telehealth. So it's one of the things that falls under telehealth. And it's really the use of emails, phone calls, faxes, texts, and live stream videos all fall under telemedicine. Telemedicine by law can be provided to existing patient, and we'll see how that changes with the current situation of COVID-19 as we talk about the different insurance companies. So telemedicine can be provided to existing patient, and it has to be a patient-initiated service. So for starters, you say to yourself, well, how would my patient initiate this service? It's okay to reach out to your patients and send your patients email or even check on your patients and let them know that you're there for them and that you're offering telemedicine services. Right before this webinar, I actually spoke to one of my clients, and I said to my client, you know, while your office closed, you can offer telemedicine. She goes, oh, no, that's not for us. We're an acupuncturist office. I know. But what we need to see is that an acupuncturist, you also can offer telemedicine, and we shouldn't devalue our services. One of the things that many patients appreciate is the reach out for the patient, the ability to have that discussion with the patient. And it's not just when a patient comes in and you put in needles. Yes, that's very effective and it's such a great medicine, but also that connection with the patient, the discussion with the patient is something that you'll see gives a great value and great benefit to your patient. Telemedicine is considered an evaluation, or some of you may know, an E&M codes. So it's not the actual needling of a patient, but it is an actual evaluation. And you will provide your patient with the same standard of care that you would have provided your patient when they were sitting in your office, except this time it's going to be via live stream video. As I said before, the law says that the patient has to be an existing patient that is already under your care for either acute or chronic pain. Now, we talked about telemedicine being either text or faxes or emails or phone calls or live stream video. When it is a phone call and it does lead to you seeing the patient within 24 hours, we cannot bill for telemedicine, but we do have to bill for the acupuncture session. Since most of us are closed, that scenario probably will not occur, but I just want you to know what the law says. Okay. I want to talk specifically about the state of Washington and what we're looking at with the state of law of Washington about telemedicine. So telemedicine by the state of Washington is allowed. Medicaid does offer telemedicine. Usually it's performed via live stream video. One of the things that we are seeing that Washington has stated that, one, we must have a patient consent out there. So before performing these services, make sure that you get consent. I'm not an attorney, so I can't tell you exactly what would be in that consent, but one of the things that I would include that in the event that there is your data gets compromised because you're using a live stream video or you are using text or email, that you are not liable for the data being compromised. So that's one thing I would include in that consent. The state of Washington also puts in that it has to be a live stream video and that it has to be effective and beneficial to the patient. We'll talk about the specific insurance companies as we get to the insurance companies, but one thing that we are seeing when we get to telemedicine and we are speaking to the different insurance companies when we are verifying coverage is that if acupuncture is not covered for a patient, for the most part, they will not allow that specific provider to provide telemedicine. So if I'm an acupuncturist and I treat Jeffrey, and Jeffrey does not have acupuncture benefits under his plan, the insurance companies would not allow the acupuncturists, and that's 95% of the time is what we're seeing. They will not allow the acupuncturist to treat that same patient for telemedicine by an acupuncturist. That doesn't mean the patient does not have telemedicine services. It means that just the acupuncturist is not allowed to treat. If the patient does have acupuncture benefits, we are seeing that most insurance companies are allowing telemedicine. Okay. Now, self-funded plans are allowed to exclude telemedicine out of their plans, and I'll talk about self-funded plans when we get to talk about the different insurance companies. Okay, so I'm going to use telemedicine for considering that I'm not sitting with my patient in the office and I'm sitting across the screen on a live stream video. So A, it's a discussion with your patient about their current diagnosis and how they're feeling, and maybe talk about some stress relief points or better eating habits or even way to build your immune system. Things that you can do are things such as tongue diagnosis. You can give your patient some Qigong exercise, Tai Chi, yoga, breathing exercise. You can either show them 1 or 2 examples on how to do it, or you can do it with them during your session. Some of my clients have took kits of ear seeds and mailed it out to their patients along with some chart for the ear. And what they've done is they spent the time with the patient putting on the ear seeds while they were on the session. Acupressure points is something else that you can show your patient. If your patient is suffering from things such as back pain and neck pain that are caused because of stress, right? The use of hot and cold packs is something else that you can discuss with them. And I want to talk about the measuring of time, because you'll see that all these things that you're doing with your patient via live stream video is you'll be measuring the time spent. With that said, you will be adding the time that you prepared for the session and the time after the session when you documented the actual session. So if I'm seeing Jeffrey today at 1 o'clock, and at 12:55, I prepared for my session. So I reviewed all my notes from last time for 5 minutes, then spent some time with Jeffrey on the phone, giving him some breathing exercises, or maybe giving him some ear seeds and showing him how to do it. So I spent maybe 15 minutes with Jeffrey. And when I hung up the session, I spent 5 minutes documenting my session from 12:55 until 1:20, the whole time count towards the session. Okay, so preparation of notes and then taking the notes, whether it's hard copy or electronic notes, all count towards the time that you're spending with the patient. Now let's talk about the actual codes and the actual times. So we're looking at 2 sets of codes. So we're looking at the separations between video and phone calls, and then you'll see 3 different categories. So you'll see 5 to 10 minutes, so you have to have at least minimum of 5 minutes. You'll see a category of 11 to 20 minutes, and then a category of 21 to 30 minutes. If you spent an hour on the phone with your patient, you're still going to charge for $99443. If you spent an hour with your patient on video, it's $99423. Okay, anything over 21 minutes, you're going to be charging for that last code, whether it was done via video or a phone call. Okay, this code can be charged only once every 7 days, unless the patient presents themselves with a new diagnosis. So again, we'll go back to our Jeffrey example. So if I spend time with Jeffrey today is Monday, and I spent some time with Jeffrey and we spent 5 minutes talking, and then tomorrow I spend another 5 minutes, I'm going to add all the minutes together, and I'm going to charge only once for the accumulation of all the minutes. Okay, that's true for either video or phone calls. Okay, the modifier that you're going to be using is modifier of 95, and again, that depends on the insurance company. With a place of service of 02. So usually when we look at place of service, we put 11 because we treat in the office. In this place, we're going to use, in this particular scenario, we'll use 02 when we submit the claim. And I'm going to give Jeffrey a minute to bring up just a sample of a claim so we can take a look at how it was submitted. So we're looking at the HIPAA form, and we're looking at a start date and an end date. And you can see in column B where it says place service, it has 02. Usually we would put 11 on that form, but in this particular case, we put 02. We put in the code. So if I spoke to Jeffrey together via live stream video for 20 minutes, I'm going to put 99423, and I'm going to put a modifier of 95. Okay, now back into our slides. And what I want to talk about now is how do we charge for these codes? So I want to make sure I'm not going to give you prices on how to charge for these codes, but what I'm going to give you is a formula on how to come up with your own pricing. So you have to look at what we are charging today for one set of needling. So one set of needling, 7810, if I charge $100, you can see the code 99421, and I like to round things up to just make things simpler. I'm gonna charge for it about 40% of what I charge for 97810. So If I charge for 97810 $100, for 99441, I'm going to charge $40. For 99422, okay, I'm going to charge about 80%. So I'm going to charge $80. And then code 99423 is actually, in terms of value, it's worth more than one set of needling. So I'm going to charge about $120. And this is how I figure out my value based on these, what we call relative value, the comparison that the insurance companies have with these different codes. If you don't know what relative value is, I wouldn't worry about it. You just need to understand what it is worth in terms of a comparison to one needling. And we can see that 5 to 10 minutes are worth about 40%. 11 to 20 minutes are worth about 80%, and then 99423 are actually worth a lot more, or more than 97810. I want to talk about the different insurance companies, and then I'll talk again about the modifier. I want to jump back to the modifiers. What I've done here is high level of the different insurance companies and what they allow and what they don't allow. You have to take this chart with a grain of salt. For starters, you need to know that on a daily basis, because of COVID-19, things change as to what's allowed and what's not allowed. More and more insurance companies are waiving the copay. Some insurance companies are waiving the copays, but only if you're in network with them, not if you're out of network. As of right now, we are seeing that insurance companies have allowed from sometimes the beginning of March, some started beginning of March, some the middle of March, all the way up to June, providers to provide telemedicine. Premier specifically is allowing it until the May 31st, but one of the things that they put on our website is to continue checking to see if things were extended out post-May. We are seeing that Blue Cross, for example, allowing in-network providers, and they're waiving the copays, the co-insurance, the deductibles. They're also not really looking at timely filing. So as we are familiar, most insurance companies have timely filing as to how long or from the date of service you can submit a claim before they're no longer accepting it. In these scenarios, the insurance companies are waiving it. American Specialty Health, as of right now, are not allowing telemedicine. They're not allowing telemedicine because they haven't gotten guidelines from the insurance companies that are administering their services for. So we know that American Specialty Health in some states are administering for Cigna, and sometimes they're working with Blue Cross Blue Shield. As of right now, they're not allowing it. It doesn't mean that in a day or two they will not continue allowing it, because they're just waiting for the guidelines. It's as soon as they get these guidelines, they will then may permit telemedicine. Companies such as United Healthcare is right now not allowing telemedicine. But again, because this changes daily, I would suggest that you check with your insurance company. As I said, this is high level, and we didn't list all the insurance companies. I see some people asking about Kaiser, and Kaiser is allowing it for only their in-network, but it does depend on a patient's plan. I suggest you call the insurance company for every patient that is interested in telemedicine. Find out if telemedicine is allowed, and not only is it allowed, is it allowed to be performed by a licensed acupuncturist? Because yes, we care if telemedicine is allowed, but I don't care if a chiropractor can do it. I care if I can do it as an acupuncturist. So that's what you want to find out. You also want to document who you spoke to, what was the date that you spoke to, and take a call reference number that in the event where your claim later on is not paid, you have a way for the insurance company to pull that phone call back. Listen to the phone conversation when the rep told you telemedicine is covered, because this does give you ammunition for them to then take this back and pay for it. So A, call on every patient. B, document who you spoke to, a call reference number, find out if co-pays, deductibles, co-insurances are waived. Do you need a pre-authorization for the patient to be treated? If so, how do you get that pre-authorization? And again, document who you spoke to. So that is specifically for these insurance companies. I want to talk a little bit about Cigna because Cigna have laxed their guidelines. So here's what Cigna published on their site. Cigna published on their site that their system will not be able to accept telemedicine codes, and sometimes the telemedicine codes will get denied, although we are seeing the telemedicine code should be submitted with location of 02 and the 99423 or the 99422, those telemedicine codes that we're looking at here. Cigna said that we should use the regular E&M codes. The regular E&M codes are 99212, 99213, 99214, 99215, right? Obviously 99211. With a modifier, though, of GQ. So when you are submitting a claim to Cigna, you are going to use location code of 11, the CPT code or procedure code of 99213 with a modifier of GQ. With that said, we did submit as a company, as a billing company, when this whole thing started and we had patients and providers that were interested in telemedicine, we did submit to Cigna the telemedicine codes, and they got processed and they got paid. Cigna paid about $50 for these codes, and Aetna paid about $70. So we are seeing these codes paying between $50 to $70. You have to remember that that changes based on the state that you're practicing in and the location. And the reason that it changes is because they look at state and where you're practicing as to what's reasonable and customary. And they're looking at what other acupuncturists are charging for these codes, and that's how they come up with what's reasonable and customary. So that may vary a couple of dollars here and there from what we are seeing the claims to be paid. I'm going to move on to the last slide. I want to talk about HIPAA and I want to talk about consent. You must have consent from your patient to treat for telemedicine. HIPAA rules, I would exercise HIPAA rules. I would use a system that is HIPAA compliant. Although we're seeing that during COVID-19, the HIPAA penalties are not being enforced. The links that I put in here are some companies that are HIPAA compliant and they have some sort of a version that is free. Either they're using a certain number of sessions and that's free, or they have a free trial for a month. Doxy.me, I think, has a very cheap monthly fee. Maybe it was $15 to $25. I don't remember. Maybe Jeffrey, when he comes on later on, can tell me what the price was. But I think they had a really reasonable price for their telemedicine video conferencing live stream. Other than that, I will be happy to answer questions as we are opening it up for questions. Okay, Jeffrey.
All right. Well, thank you so much.
Of course.
And actually, I'm pretty sure from the research I've done, Doxy.me does have a free option. So anyone who goes to their website can use the services for free. There will be limitations on the free services. So obviously for busier practices or practices with multiple practitioners, there's probably a cost, but to get started, you can definitely use those services for free. And then we do have a few questions here, so let's get started. So, people did ask about Regents, United and First Choice. If you have any info on those insurance companies.
I don't. I only have on United. We didn't call anybody specifically with Regents, but I would take a patient that you have who has Regents. I would give them a call and ask them if telemedicine is covered by a licensed acupuncturist. you just need to make sure that you specify by a licensed acupuncturist, as it's new to many of the reps that are on the phone. So, they're confused with a regular MD or a psychiatrist, but let them know you're a licensed acupuncturist and you want to know if that service is covered.
And the next question, if a patient has 12 visits allowed through insurance, does the telemedicine session count as one of those visits?
Okay, so what we are seeing is that the sessions are not counted toward the visit limit because they are considered as E&M codes or evaluation codes. They do not take away from the acupuncture visits. However, if a patient does have a limit on the number of evaluations, we are familiar with some insurance companies that allow you to do one evaluation per year, or they have a dollar limit of what they will pay the acupuncturist. There may be a limit. So that's one of the questions I would ask the insurance company when I call to verify the patient's coverage. If you do know that there are some restrictions, i.e. related to diagnosis or related to a dollar limit or a visit limit, ask these questions, prepare all these questions ahead of time, and ask these questions up front.
Alrighty, and then are you only allowed to treat with pain through telemedicine when billing insurance?
No, it really depends on the insurance company. If the insurance company does have a diagnosis restriction, then yes, it will probably, we'll be treating for pain. When I ask Jeffrey, if Jeffrey's suffering from anxiety or Jeffrey is suffering from insomnia, my next question to Jeffrey is, does the anxiety cause you any pain? And you can see in many of the patients that do suffer from anxiety, they'll have maybe shoulder pain or neck pain or migraines or headache because the anxiety will interpret into some sort of a pain. I know it's true for me, maybe true for a lot of other people out there. So.
Righty. And then somebody asked about if we have an example of a consent form. The other day I was actually in a webinar and an attendee shared one, so I can't say for if this is a good one or not, but I'm going to put a link in the chat with it, and feel free to look it over. Again, it's not provided by LASA OMS or by Sarit, but somebody had shared it, so hopefully find it useful.
And then, Jeffrey, I would suggest that you read this consent form and make sure that you, as a practitioner, are covered and covering all your uses, especially if you're not using a HIPAA compliant system and the data gets compromised. You want to make sure that that paragraph is in there from a liability perspective.
Alrighty, and then do you have any info on the VA about coverage?
So we are seeing that the VA does cover telemedicine. You will need to call the VA and just confirm for that specific patient. It does take away from your visit limit. So from a VA, we usually know that the VA gives you a number of sessions with a start date and an end date. Considering that our patients cannot come to the office, you can use it towards telemedicine. Be aware that it does take away from one of their sessions.
Alrighty, and then follow-up question. So there is no diagnosis restriction separate from what the insurance company usually covers?
There is a diagnosis restriction if your insurance only covers for that specific diagnosis. So for example, if we're looking at Aetna, and Aetna considers acupuncture to be medically necessary for about 10 codes. Right, which is lower back pain, migraines, right, hip pain. I don't see them covering telemedicine for anxiety when it's provided by a licensed acupuncturist, is they don't consider our medicine to be medically necessary for anxiety. So I would stick to the codes that the insurance company is providing if they are providing some sort of a restriction.
Alrighty, and then okay, so Karen had mentioned actually that she had billed Regents for 2 telemedicine so far. It looks like she said she billed the E&M codes and they both got reimbursed. So that's some good information for other attendees here.
Do we have a percent on what they got reimbursed? If we can share that, we think that would be great as well, just so people know what they're paying. And then if you can tell us also if you're in or out of network, I think that would be useful information, Karen, for everyone.
Thank you so much for sharing this, by the way, Karen. We really appreciate your time here. Let's see. In the meantime, if she's able to share, I think we have one other question. It was, kind of similar to some of the others. Somebody had mentioned about Blue Shield and, First Choice, and just as to whether or not any of those getting refunded or reimbursed.
So we are seeing Blue Shield, but again, it depends on the patient's plan. We are seeing them getting paid both on the East Coast and the West Coast. But again, you have to find out if the patient has, just because Blue Cross says, yes, we're covering, it doesn't mean they're covering it for every single patient which you have in your Rolodex. And I guess I'm timing myself. I'm aging myself with this Rolodex term, but yeah, you do have to check the coverage for your patient.
All righty, Karen's actually looking that up right now, so we should be able to share that information shortly. But we do have another question from Angela. In the meantime, a limit on how many telemedicine visits that a client can have per 7 days with multiple practitioners, or is the 7-day rule just for one practitioner?
So the 7-day rule is for one practitioner. And I want to make sure that I add something to this, is if the patient presents themselves with a new diagnosis. So today I talked to Jeffrey, and Jeffrey's suffering from back pain. Tomorrow, or in 2 days from now, Jeffrey has terrible migraines, and we're discussing his migraines. You are allowed to bill for it once again, because the diagnosis that we are discussing is a totally different diagnosis. And I'm watching my lights here because we have a terrible storm here. Yeah, but the diagnosis that we are discussing is a totally different diagnosis, and you can bill for it again. But I wouldn't, it's not something that I would do on a regular basis. I would bill for it. I would try to billing for it once every 7 days.
Okay. This question might be more for everybody who's in the audience than you, but Kelly was wondering if anyone has had their practice insurance deny telehealth coverage. I do know that the American Acupuncture Council is accepting telehealth as they're covering telehealth visits. They just said that you have to contact them to turn on the telehealth feature. Basically, they just want to know that that's what you're doing ahead of time. Have you heard anything from any other companies, Sarit?
No, that's what I heard, the same thing as well. And I know that Rob, who's my partner, got an email from them saying that they are covering practice for telemedicine, as you said, and it needs to be turned on. Perfect.
Well, at least right now, I don't see any other questions or comments here. Looks like Karen wasn't able to get that information for us, but at least we know that the E&M codes were reimbursed through Regents, which is a nice feature. And we really appreciate all of your time today, Sarit.
Of course.
So I want to thank everyone for taking their time out this morning to listen to us, and we hope that you got some valuable information here. Just to let you guys know, we do have some upcoming webinars planned. Oop, Karen's still working on it. So while she looks that up, I'll talk about some upcoming events that we have planned. So we do have on Wednesday this week at 11:30 p.m. Eastern, which will be 4:30 p.m. Pacific time. We'll be having Michelle Gellis talking about changing the face of our practice by adding some cosmetic treatments in. Karen did follow up, so she billed $99213, and $42.50 is what they reimbursed for pain. And then Karen, were you in network or out of network? That would be the next valuable question there. And then also to mention is something that we have coming up, that one of our partners, Net of Knowledge up in Canada, they're doing daily webinars each day throughout the month of April. So if you visit netofknowledge.com, actually I will put a link in the chat. You actually can visit these daily online gatherings. So there are free webinars, and then after the webinars, there's a chance for everybody who joined to get together and talk about what they just learned. And Karen is in network, just so everybody is aware. All right, so Karen is in network. She billed Regents the E&M code 99213 and was reimbursed $42.50 for a pain diagnosis. How does that sound good, Sarit, to you?
Yeah, those are the in-network prices. I see she billed actually for not an M diagnosis. So what she did is, right, if we're looking at what Karen did, and I want to go back, Jeffrey, to the slide for 1 second of billing, right? So she billed for allergies. She did use the E&M codes, the regular E&M codes, not the telemedicine codes. And actually, I want to use that Cigna, if we can bring up this, not that one, the Cigna HIPAA form, the form on how to submit a claim.
Yes.
So she used the regular evaluation codes with a modifier of GT. A modifier of GT is also a modifier that indicates telemedicine. But in case in office, where you see in column B, instead of putting 02 for telemedicine, what she used 11, okay, which is also doable. Okay. So just so you're all aware, there are different variations for the different insurance companies. They do publish it on their site. And if you're not sure, try it out. If not, submit a corrected claim for your claim to get paid down. Or use your biller. If you have a biller, I'm sure your biller will know how to do it. And if you're looking for a biller, we'll be happy to do it for you.
All right. Well, AllAcuServices, LLC, is Sarit's business. So if you guys need some help with insurance billing, she welcomes all new clients. So please feel free to reach out to her. Once again, I want to thank everyone for taking some time this morning to listen to Insurance Billing with Sarit. And we'll hope you all have a wonderful day. And Sarit, I will see you tomorrow to talk about Florida.
Yes.
All right. Well, everyone have a great day. Take care.
Bye.
Bye-bye.